Akeem Olufemi Gbajabiamila. God bless you all. Today, Nigerian health institutions have been stretched beyond its capacity in the past 1 year.
Lawmakers raise alarm over possible Ebola outbreak. Ask government to be proactive.
386 of them resigned, and we discovered that the issue is just about welfare.
And House adopts recommendations on how to forestall mass resignation in the military. It's another fresh package of House tickets coming your way on the NTA Parliament. Lawmakers in the week on the review called on the federal government to be proactive to forestall a possible Ebola outbreak, even as neighboring countries battle the virus. The House is also calling for effective monitoring of welfare packages meant for the Nigerian Army. These reports, as well as an update on bills under consideration, coming your way on House ticket. Stay tuned for the full package right after this timeout.
If we set our minds right, embrace each other in love and brotherhood, we will come through these troubling times. We will survive, we will recover, and then we will thrive. One nation under God, free, peaceful, and prosperous.
The consideration of bills and motions as well as committee reports characterized plenary activities as far-reaching resolutions were arrived at on the legislations considered, ranging from investigations, amendments of existing laws and the Constitution to security-related matters. Let us take the full report as compiled and presented from our studios.
Proceedings for the week under review saw the House sitting in plenary on 2nd and 3rd of March 2021. One of the bills considered at second reading was for a constitutional amendment.
The bill for an act to alter Section 254F, subsection 2 of the Constitution of the Federal Republic of Nigeria, 1999, as amended.
Sponsored by lawmaker Abbas Tajudi, the bill seeks to alter Section 254F, subsection 2 of the Constitution of the Federal Republic of Nigeria, 1999, as amended, to delete the entire provision on ground that the reflection of the Evidence Act, the Criminal Procedure Act, and Criminal Procedure Code in this provision is superfluous and for related matters. There was no debate on the bill. It was referred to the Ad hoc Committee on Constitutional Amendment for more legislative work.
Please against me saying it. Ayes have it.
At third reading, the House passed the bill for an act to amend the National Primary Healthcare Development Agency Act of 2004 and for related matters. For motions taken under matters of urgent public importance, an urgent need to create immediate public awareness and preparedness to combat possible outbreak of Ebola virus and to take measures to avoid it was deliberated upon during plenary of Wednesday, the 3rd of March 2021. Representative Unyime Idem sponsored it.
On February 7, 2021, the Democratic Republic of Congo had again announced a resurface of a new case of the Ebola virus, months after the outbreak was declared over in the region. In the same vein, on Sunday, February 14, 2021, Guinea's Ministry of Health also declared an Ebola outbreak following the mysterious death of 3 persons. Today, Nigerian health institutions have been stretched beyond its capacity in the past 1 year and cannot afford to witness another outbreak of dreaded virus.
The motion called on the House to urge the federal government through the Ministry of Health to enhance surveillance at point of entry to respond to any suspected outbreak of Ebola coming from neighboring countries, especially Guinea and the Democratic Republic of Congo. Urge the federal government through the Ministry of Information to create awareness on the deadly virus. And urge the Federal Ministry of Health to work with the West African Health Organization and World Health Organization on strategies to bring the Ebola outbreak under control and provide for regular updates and preparedness containment and response measures. The House Committee on Healthcare Services has been mandated to ensure compliance to the resolutions of the House on the motion as adopted.
We say aye. Those against, we say nay. Ayes have it.
Another matter of urgent public importance was on the urgent need to investigate the allocation of crude under the Direct Sale, Direct Purchase Scheme (DSDB), sponsored by lawmaker Maki Yeleman.
Ayes have it. Matter referred to the downstream committee.
That according to the report, approximately 5.2 million barrels of crude oil supposedly allocated to Comotor's and NPC refineries in 2018 under direct sale, direct purchase operation are unaccounted for. Essentially, almost half of the 10.9 billion barrels of crude oil allocated for domestic supply between June 2018 and July 2019, as reported by the NNPC, is either stolen or diverted.
Being investigative in nature, the House adopted the motion to investigate the allocation of crude oil under the Direct Sale, Direct Purchase Scheme from 2018 till date, crude oil allocation per refineries and the rationale for such allocation, and what happens to unutilized stock of crude oil in the case of refinery with inadequate production or capacity.
We say aye. Those against, we say nay. Ayes have it.
A motion from the order paper of Wednesday, the 3rd of March 2021, asked the House to call government's attention to the education sector over various issues ranging from funding, curriculum review, and infrastructural development. The motion, titled Parlor State of Hostels in Tertiary Institutions in Nigeria, was sponsored by Representative Olalekan Rashid Afolabi.
The House notes the deplorable states of infrastructure in Nigerian tertiary institutions and dilapidated hostels, roads and transmission networks, non-provision of potable water, poor power supply, and lack of sewage treatment facilities. A demeaning environment will invariably expose students to recurrent environmental and health hazards, such as cholera, dysentery, food poisoning, gastroenteritis, skin infections, frequent visits to the hospital, and sometimes death.
Other prayers of the motion adopted include that all tertiary institutions be urged to partner with private institutions to go into public-private partnership contract agreement (PPA) to build hostels in tertiary institutions based on build and operate by developers in a way that will allow the developers to dispose of the property to the university after an agreeable time, and that the House mandates the Committee on Tertiary Education and Services to ensure implementation. Plenary of Tuesday, the 2nd of March 2021, had Deputy Speaker Ahmed Idris Wasi presiding over the sitting in the absence of Speaker Femi Gbajabiamila.
And prosperity of Nigeria. Amen.
That Tuesday saw the passage at second reading of the Bill for an Act to establish the Sustainable Development Fund, charged with the responsibility of imposing, operating and maintaining the fund for the attainment of sustainable development goals in Nigeria and for related matters. The sponsor justified having a trust fund for SDG projects.
Since Nigeria is operating at SDGs, and even in the House of Representatives here, we have a committee on SDGs. The SDGs oversighting, the committee is oversighting SDGs. And therefore, all we need is to have a legal teeth that will give the SDGs a smooth sail.
Lawmaker Abdulrazak Namdas called on his colleagues to support the bill and for the political will by all stakeholders to meet the laudable targets of the bill. There was no further discussion on the bill. It scaled voting and was referred to the House Committee on Sustainable Development Goals for further work. The House also considered a motion on the need to urgently rescue Pastor Bulus Yukura of Pemi EYN of Chibok Local Government Area in Chibok, Damboa, Goza Federal Constituency of Borno State as a result of Boko Haram captivity.
On Wednesday, the 24th day of February 2021, the Boko Haram released a video clip showing Pastor Bulus Yukura clamoring for help and giving him 1 week to facilitate his release. Worried by the continuous closing of 1 week period given by the insurgents, concerned that at the expiration of the deadline, anything can happen to Pastor Bulus Yukura.
The motion also pointed out that the village of Pemi, where the pastor was abducted, had been burnt to ashes, 8 people killed, while food, amongst other items, were destroyed and carted away during the attack. The prayers adopted by the motion therefore called on the House to intimate the federal government to do everything possible to secure the release of the victim before the deadline. And the National Emergency Management Agency, NEMA, Northeast Development Commission, NEDC, should come to the aid of the families of the deceased persons and alleviate the sufferings of the victims whose houses were burnt and food items and other materials carted away. At the Committee of the Whole House that Tuesday, the report of the Committee on Army on the purported voluntary resignation of 365 soldiers from the Nigerian Army was considered at the Committee of the Whole House. A motion prompting the investigation was adopted during plenary of Tuesday, the 14th of July 2020 and referred to the House Committee on Army for investigations.
During the course of our investigations, we discovered that soldiers can resign from the Army after 10 years. Once you serve after 10 years, you have the right to resign from the Army. And it can be voluntary or it can be compulsory. And therefore, on the course of our findings, we discovered that not only 365 soldiers that were actually voluntarily resigned, about 386 of them resigned. And we discovered that the issues is just about welfare. And in our recommendations, we stated that to avoid mass resignation from the Army, because every year in, year out, people resign from the Army. So we recommended that the Nigerian Army should improve on the welfare of its personnel, especially those in battlefields or other combat operations, to further make them more committed to their job and to the nation at large.
Other recommendations of the committee include that there should be effective monitoring or follow-up in the delivery of the welfare packages in all Army formations to ensure that they reach out to all beneficiaries in a fair and equitable manner. That the Army should continuously embark on orientation of soldiers, both old and new, about the reality of their jobs and the need to be committed to their country. This will reduce the number of soldiers leaving the Army due to loss of interest.
Recommendation 2. Recommendation 3. Thank you, Leader.
Many thanks for still being there. Still talking bills considered during plenary of last week, we sought more clarification on the bill seeking for constitutional alteration of Section 254F2 of the 1999 Constitution as amended to delete the entire provision on ground that the reflection of the Evidence Act, the Criminal Procedure Act and Criminal Procedure Code in the provision has been superfluous and for related matters. Lawmaker Abbas Tajuddin, who sponsored the bill, explains that the alteration being sought is to cure future problems within the judicial system.
The provision of that particular section gives powers to the industrial code that we felt is unnecessary. And those powers include powers on criminal proceedings and jurisdiction over issues of criminal proceedings, which from our investigation has already been taken care of under the criminal administration procedures. So the fact that in the Constitution, those criminal procedure provisions are already embedded in the establishment, in the act that establishes industrial courts, is completely unnecessary and is ambiguous and could create problem that has to do with the powers and jurisdiction of the courts.
The bill being a part of the Constitution is expected to undergo scrutiny during the review of the Constitution by the 9th National Assembly, a process which has already started.
I don't think it will be controversial. It will be something that will be given a very speedy consideration, particularly the area of the issue of these criminal jurisdictions that I have told you, which everyone in the law profession is aware that industrial court does not have power to entertain. And since it is that particular area that we want it to be expunged completely, I believe it will probably not be subjected to too much scrutiny, public hearing, and so on. It will be debated, I'm sure, by the Nigerian Bar Association and the judiciary, But at the end of the day, I think it's a very straightforward issue.
Away from bills now to other events of the lawmakers in recent times, there have been calls on the Independent National Electoral Commission, INEC, to adhere to a constitutional provision on the review of the federal constituencies after every 10 years. Several motions have been considered to that effect during chamber sittings in recent times. In line with this, Minority Leader of the House leading other members recently briefed the media.
There's already a provision giving INEC the power to solely, it is only where there is no provision of such, then INEC can come back to us to say we should alter the constitution to insert that INEC should review the constituencies.
He further gave reasons for the agitation and how INEC should go about the exercise.
As at the time this thing was written, we were not up to 200 million. Now we are 200 million. And the greatest thing injustice that can happen is to deprive the people at the rural areas or at the grassroots the opportunity to be so represented close to government. In order for us to tinker with increasing constitutional review, please, this is our take. We need you to improve based on our interaction from stakeholders and also checking the population of Nigeria. What INEC can be doing, if he wants to push to that, is to come to us by way of extra budgetary provision. If in the event that the money he has to embark on that process is insufficient.
Up next, lawmakers discussed 6 bills aimed at improving Nigeria's health sector. Just as a fact-finding mission takes place where lawmakers visit the government agency, Galaxy Backbone Limited. Details right after this short break. Please stay tuned.
We have to do away with the issue of...
If there are challenges, you can always come to the National...
We must back that effort.
If there was only 2% left, why didn't the ministry inject some money for 20?
Why it's fighting for the same area that they were planted there? And you expect to come and clap?
The House Standing Committee on Healthcare Services has assured Nigeria that the 9th House will see to it that healthcare issues in the country are addressed. It gave the assurance during a recent public hearing organized by it to deliberate on 6 bills around the health sector. This was on Tuesday, the 2nd of March 2021. The Speaker was represented at the event.
We expect that when these 6 bills become law, they will each serve to improve our national health system in specific and significant ways that will impact the lives of our nation as well as the people.
The chairman of the committee earlier in his welcome address said the National Healthcare Act of 2014 serves as the bedrock for all healthcare services in Nigeria. Therefore, the amendment of the Act to define basic minimum package of health services has become imperative. The amendment bill is to provide a mechanism for realizing the objectives of the Principal Act in providing free healthcare services to all Nigerians without prejudice to the requirements of payment to the contributory scheme stipulated in the National Health Insurance Scheme Act and for related matters.
The dream of the bill to serve as a foundation of building universal health coverage in the country is still far lagging behind. There was slow in implementation of the Act, with much attention given to basic healthcare provision fund, neglecting some part of the bill that will enhance services in our health institution.
The amendment of the National Healthcare Act of 2014 will also enable inclusion of effective response mechanism to unforeseen circumstances such as the novel coronavirus pandemic.
The amendment of the Act will allow us now to include challenges hitherto that they were not there, but were noticed during the COVID-19 pandemic, especially in ensuring resiliency of healthcare delivery services in the country be addressed in the current amendment.
The Minister of Health lauded the commitment of the House in the health sector as seen in their various strides on matters of health since inauguration of the 9th Assembly. He then spoke to the proposed amendments to the National Health Act of 2014 to define a basic minimum package of health services.
This act has not been fully implemented. Many states have, for example, not yet set up their mechanisms for carrying the National Health Act forward, for opening, for example, their basic primary healthcare development agencies and health insurance agencies and the mechanisms for transfer of resources to the states. So it is still in development. And I would like to add that that basic minimum package of healthcare services has been grossly expanded now. Before, it was in the 2018 manual, it was just to measure your blood pressure, take your blood sugar, and if you have diabetes or hypertension, tell you to go and take treatment. But right now, the expansion gives full treatment to those who are diagnosed, both with hypertension and blood pressure.
He made comments as well on the bill for an act to amend the Compulsory Treatment and Care for Victims of Gunshots Act to expand and bring the long title in conformity with the actual intendment of the bill, provide stiff punitive measures to check violations and other related matters.
That the compulsory treatment should not just refer only to gunshots. What of people who have been stabbed? What of people who have been knifed? What of people who have been clubbed? What of those who have emergency from other sources? What of women who cannot deliver, who are bleeding in the night after delivery? It's an emergency too. They must also be attended to. In short, what I will say here, if I will say that this bill should be for an act to amend the compulsory treatment and care for all people in distress, the National Health Act actually already made provision for that.
The Director General of NAFDAC lauded the objectives of the proposed amendment to the NAFDAC Act of 2004, which is a consolidation of 3 bills seeking various amendments. The proposed amendment to the NAFDAC Act seeks the introduction of coordination of clinical trials and some new offenses, increased penalties for commission of offenses under the bill. The amendment of the NAFDAC Act also seeks to capture other forms of packaged water other than in bottles and encourage cooperation with other relevant agencies in carrying out its functions. However, the part of the consolidated bill which seeks to amend the Act to provide for payment of all monies received by the agency into the Federation account in accordance with Section 162 of the Constitution of the Federal Republic of Nigeria 1999 and for related matters was opposed by NAFDAC.
Actually, it is not just us. It is WHO. They came, 24 members of the WHO came 2019 June to tell us that we have weakness in this our act. We need to strengthen it. We wish to express our opposition to this paragraph or to this proposed amendment, because what the amendment is saying is that every penny that NAFDAC realizes every day must be put into the consolidated account, and we will not be able to use it, which means we will not be able to buy gas, fuel, to fuel our vehicles until we apply to get it from consolidated account. And this is in opposition to the act that formed the NAFDAC.
Additional presentation by NAFDAC opposed the proposal to establish the National Agency for Food Technology Development and for related matters, and the bill for an act to establish the Nigerian Food Safety and Hygiene Surveillance Corps 2020 with the function, among others, to regulate, supervise, oversee food safety and hygiene practices in markets, eating places, training, issue of national licenses to persons participating in raw, cooked food, handling businesses in order to avoid food and water contamination and mishandling and for related matters. NAFDAC says the 2 bills duplicate the functions and mandate of its agency, while risking running into problems with the African Free Trade Agreement. The Nigerian Council of Food Science and Technology also agreed the 2 bills duplicates its agency's functions.
The Nigerian Council of Food Science and Technology Establishment Act 2019, which is less than 1 year in application and covers adequately the issues of food, should be tested before other considerations.
The National Blood Transfusion Service Agency, on its part, agreed that establishing a national electronic health record system for the storage and access of electronic health records in Nigeria and for related matters being one of the bills up for amendment is a welcome development.
The Universal Electronic Health Record System would be immensely valuable in ensuring data availability, tracking, monitoring, and evaluation of health services in Nigeria. It will enhance transferability of data from facility to facility across states and regions to ensure continuity of care, reduce time wastage, assist with hemovigilance for blood safety, and enable public confidence in the system.
Health record officers of Nigeria, however, had a different opinion on the proposal to establish the National Electronic Health Record System.
And there's no components that we have not included, right from clinical to administrative and account and billing system. These are encompassed into one medical record unit of a patient. Now, if you want to establish a regulatory body, there must be somebody to regulate. Number one, we don't know who are they going to regulate. Where are the training institutions that train them to be specialized in electronic health record? What is the qualification that will be awarded for them? And why are you trying to even introduce a law that there's nowhere in the whole universe that such law is applicable?
The Food Safety Surveillance Corps Establishment Bill, on the other hand, will duplicate the existing act, which established the Environmental Health Registration Council that ensures food safety, hygiene, and training, among others. The stakeholders called for the bill to be stepped down. The committee adjourned Synodine while it is to collate all memoranda submitted and fine-tune the opinions of stakeholders for final copy of the amendments agreed on by all involved.
That's the much we can take on this package of House ticket. We'd love to hear from you through your questions and comments on the workings of the legislative arm of government, Federal Republic of Nigeria. You can send your feedback through the channels showing on your screen. Many thanks for watching and keep safe out there.